7:12. I think it's almost sunrise time. So thank you with me for being with me. In the morning, I'm slow. I didn't have my coffee, but thank you very much for being here in the coffee shop for humanity. I'll go get coffee afterwards. Ideally, coffee should be served here. Okay, so good news about South Africa, or from South Africa, Gauteng province. And I would go over the report, but the summary is very interesting. The summary is lesser number of hospital admission. Remember, there is a Omicron wave there. There is a higher spread. Lesser number of hospital admissions actually means that they have mostly patients either at home or in the hospitals. In the outpatient, they are being handled. Lesser number of older age folks above 50. And the report says that that may be because they are vaccinated. So it is possible that vaccinated have even milder cases, but it looks like unvaccinated, you would see a lot of patients are actually unvaccinated who are in the hospital or outside, and they have mild symptoms, no need for oxygen. So less number of admissions, less mild, less cases, severe cases, no death related to COVID in last 2 weeks. So that no oxygen requirement, hospital stay of only 2.8 days compared to 8.5 days earlier. So this all is a good news. And they say that we are sure that almost 100% of the cases now are Omicron in the area from where this report is. So I think that this is a great news. For me, how it translates is in this. And please, my apologies if somebody gets offended. I am now thinking aloud. I may be wrong. Please don't make any decisions based on what I'm saying here. This is just me thinking aloud. My thought is, I think it seems like we as a humanity would luck out if this is what happens, that Omicron is more transmissible and less dangerous, less lethal, less damaging. What we do not know yet is about long COVID. So that is still a question in my head. And a Cool Bean on Twitter asked that as well. So long COVID is still not known. I'm still continuing to think aloud with you. Once again, this is just my opinion. Um, don't make any decisions. But it looks like with Omicron, vaccinated or not vaccinated, it is not causing too much damage. And that is a good news. That is a good news in so many ways. It could be clearing out the other variants very soon if it stays this way. There's a lot of if here because the data is only for 2 weeks, 3 weeks. So if it stays this way, if it behaves this way, if it actually turns out, then this will be a great holiday gift. And hopefully we'll be doing well with this and getting out of the pandemic. But lots of hope here. Data is supporting this hope. And let's look at that data. So this report is, if I go to the bottom of the report, this is from Dr. Fareed Abdullah. This report is from the Director Office of AIDS and TB Research, South African Medical Research Council. So give me one quick second. My apologies. I forgot to do one task related to this discussion. And I just need to, 1 second. My apologies for. Okay, so continuing. So this is from their Medical Research Council, number one. Number two, if I go to the top now, this is the Dishwin District Omicron variant patient profile early features. So I'm sure I cannot pronounce it. I learned the pronunciation for Gauteng, which is actually Gauteng. So hopefully that is correct. Now, in this province, which is the global epicenter at this time, the outbreak, the fourth wave, number of cases are rising exponentially over several weeks, reaching just over 8,569 cases in Epi week, the week that was the highest so far, November 21 to 27. Can you imagine that then it is reducing? and 41,921 by 3rd December before the end of Happy Week 48, which is 28 to 4 December. The exponential rise in cases has continued with 9,929 new cases reported in Schwen in the last 5 days. I hope I'm pronouncing it correctly. Although there's a T here, so it should be Schwen in the last 5 days from 29 November to 3 December. So I think I misspoke that it is reducing. It is still increasing. But what I want to go over first, so that if you want to just stop after these couple of minutes, I want to look at the deaths first, because that is the ultimate indicator of what is happening. And of course, they say that this is just a very early stats. These are crude stats. Early stats should not be used um, as the uh, data for how Omicron will be, but they say it is a good indicator of how it is behaving. So let's look at that deaths first. And I showed that this morning as well in the other lecture. This is the number of deaths that are happening, while this is the cases that are occurring. So if I go back here, the best indicator of disease severity is measured by the in hospital death rate. There were 10 deaths in SBAH-TDH, that is the this hospital system from where the report is, cohort in the past 2 weeks, making up 6.6% of the 166 admissions. So that is the total number of deaths. I want to connect that to this sentence, 3, 4 sentences down. There were no COVID related deaths among 34 admissions in the pediatric COVID wards over the last 2 weeks. So that's a hugely important news. 4 deaths were in adults aged 26 to 36, and 5 deaths were in adults over 60. 1 death was in a child in whom the cause of death was unrelated to COVID. This compares, so again, then the next sentence that I've already spoken, no deaths in children. This compares favorably to the proportion of deaths at complex over the past 18 months, since which was 17%. So overall deaths are down to 6.6%. And they said their complexes averages, their hospital systems averages 17%. Again, they say it again and again in this report that this is too early. We would see more severity develop maybe in the coming days, and we'll see what happens. But so far, this is what we're seeing as a crude indicator of where this virus is going. The trend over the next 2 weeks will be clarified as the number of deaths is currently low and sufficient time will have elapsed for the development of greater severity of disease, and the number of deaths might be expected to increase. For now, the death rates over the last 2 weeks, as well as over the past 18 months at the SBH-TDH complex, are lower than the overall in hospital death rates of 23% for the country overall previous waves, as reported by NICD. So wanted to start from here because this is really the final outcome, unfortunately. And we are all at risk of this. It's not for someone else, it's for all of us. So the disease, this is what I was trying to understand, and we'll keep an eye on it. I'm really grateful that this report is put together. So if you see here, of course, the cases are surging, but deaths are not. And once again, the cases have been surging. Look at this. November 23, I believe majority of November is actually end up going to be the Omicron. It's just that the virus slowly continued to develop more and more in community, finally to start becoming detectable. And here, the number of deaths actually rose a little bit. So if I look at this, number of deaths rose, increased a little, and then they started reducing. So going back to the report, they say other. So again, I'll go to the top. Stats are interesting, that how many people, how many cases. But what is interesting for me is number of deaths, oxygen need, the length of stay at the hospital. So I'm going over that with you first. There were only two patients in COVID ICU in the last 14 days. Only two in the last 14 days. Neither of whom had a primary diagnosis of COVID pneumonia. 63 patients were admitted to high care, but our anecdotal information, again, they say anecdotal, is that the majority of high care admissions were for a diagnosis other than COVID. Majority of the people in the high care ICUs, possibly they have multiple structures, are for other things. And the COVID finding is incidental in them because they test COVID, which is good. So if I read their summary now, before we continue to go through this document, in summary, the first impression on examination of the 166 patients admitted since the Omicron variant made an appearance, together with a snapshot of clinical profile of 42 patients currently in the COVID wards at the SBH TDH complex, is that the majority of hospital admissions are for diagnosis unrelated to COVID 19. The SARS-CoV-2 positivity is an incidental finding in these patients and is largely driven by hospital policy requiring testing for all patients requiring admission to the hospital. This is good news. I want to add one more. So this is South Africa we're talking, but there is an interesting news from US as well, which I tweeted this morning, and I thought that was really cool. So check this out. Where is it? So hold on. Check this one out. Friends of Minnesota man. Remember, so now I have jumped from South Africa back to US. And check this out. Friends of Minnesota man with Omicron are testing positive for coronavirus. So this becomes a clickbaity headline, correct? It is the important thing in this whole. So you can imagine at 4 o'clock this morning on my bed, I was reading through these things. The most important thing is here. The man's symptoms were mild and resolved November 24. Health authorities have said he lives with other people, one of whom has tested positive on a rapid test and is being investigated further, they have said. Isn't this good? Again, one case, but now continue to collect this information and apply this with this data report that we are seeing. And you would see that this all makes sense or it is all consistent. The exponential increase in the positivity rate in these patients is a reflection of the rapidly increasing case rate of Sichuan, but does not appear to be associated with a concomitant increase in the rate of admission for severe COVID, based on the high proportion of patients not requiring supplemental oxygen. This is also a very interesting thing. Then they have a conjecture because they're seeing more youngsters. Their conjecture is it may be that this is vaccination of effect, as 57% of people over the age of 50 have been vaccinated in the province compared to 34% in the 18 to 49 year group. So, of course, I think it is interesting to keep adding the color from vaccines point of view as well. But to me, it seems like the discussion has mostly become vaccine independent because now I want to go to the vaccine and vaccine related uh, situation. So here is that part. So if you see here, these are their wards. Ward 1, vaccinated 2, unvaccinated 13, unknown 2. So you would see that unvaccinated who are in the wards are higher in number. At the same time, the important question to ask is what were the total unvaccinated folks out of those who ended up in the hospital, and then what was the severity and the possibility of death. So let's look at the wards first. Ward 1, 2 vaccinated, 13 unvaccinated, 2 unknown. Ward 3, 3 vaccinated, 8 unvaccinated, 5 unknown. And then you can see here 1 and 3, 0, 0, and 1, 6. Total vaccinated in the hospital 6, total unvaccinated 24, total unknown 8. Now, on the oxygen, total vaccinated is 1, unvaccinated are 10. So, out of 6, there is 1. So, what is that percentage? Out of 6, 1 would be somewhere about 2%. Alexa, what is 100 divided by 6?
100 divided by 6 is approximately 16.6667.
Okay. And Alexa, what is 1000? Alexa, what is 1000 divided by 24?
1000 divided by 24 is approximately 41.6667.
Okay, so that is a percentage difference. Again, higher on the unvaccinated side. And then unknown is 8 to 1. Now let's look at this a snapshot of 42 patients in the ward on 2nd December 2021 revealed that 70% are not oxygen dependent. 70% are not oxygen dependent. These patients are saturating well on room air, just common air, and are not present with the respiratory symptoms. Not They do not have respiratory symptoms. These are patients that we would call incidental COVID admissions. So they came in for other things and they found that they had COVID too. Having had another medical or surgical reason for admission, 13 patients are dependent on supplemental oxygen, of which 21% have a diagnosis of COVID 19 pneumonia based on the combination of symptoms, clinical signs, chest x ray, and inflammatory markers. All are being prescribed steroid as the mainstay of therapy. So that means that doctors are thinking possibly that the viral phase is over, and that can be from the markers and from the chest x-rays. The remaining 4 patients are on oxygen for other medical reasons, 2 previously on home oxygen, 1 in heart failure, and 1 with a confirmed diagnosis of pneumocystis pneumoniae, so other reasons. This is the picture that has not been seen in previous waves. In the beginning of all 3 previous waves, and throughout the course of these waves, there has always only been a sprinkling of patients on room air in the COVID ward. And these patients have usually been in the recovery phase waiting for the resolution of the comorbidity. So this is unusual that they're saying previously patients who were recovering would not need oxygen, or they will be lesser without the need for oxygen, mostly would need oxygen. And now we are seeing a lot of oxygen independent patients. The COVID ward was recognizable by the majority of patients being on some form of oxygen supplementation with the incessant sound of high flow nasal oxygen machine or beeping ventilator alarms. This is a good news. They are see how doctors are picking up that what their audio-visual cues were. Even these are changing. There are only 4 patients in high care and 1 in the ICU. The number of patients in high care on double oxygen, high flow nasal oxygen, or non invasive ventilation were noticeably higher in previous waves. This is anecdotal but confirmed by numerous clinicians who have previously worked in the COVID wards in the hospital complex. Do you know it is possible that in 2 weeks this whole thing gets verified? And maybe we should then lift the travel bans. Um, Of 38 adults in the COVID wards on 2 December 2021, 6 were vaccinated. We just looked at that. 24 were unvaccinated and 8 unknown. So, of 9 patients with COVID pneumonia, 8 are unvaccinated. So, that is a higher number. 1 is a child, almost out of 9, 8. So, almost what, 70-80%. 1 is a child. Only a single patient on oxygen was fully vaccinated, but the reason for oxygen was chronic obstructive pulmonary disease. So vaccinated are still enjoying a better outcome with Omicron. So then there is some more data over here. For example, the almost all cases of SARS-CoV-2 in there are new variant. First 2 weeks of the Omicron wave is continuing. Next 2 weeks by which we can draw a conclusion, and so on. So the cases are there. This is the discussion. For me, the takeaway has been that it seems like we may have found the more transmissible and less lethal variant. And um, this is nothing to do with vaccines causing selection pressures or not. The variants are forming from ever, and they will continue to form. Hopefully, if this variant becomes dominant, enough dominant, that it does not let Delta continue and it eradicates that, and it itself is less lethal, then we would luck out. But that is, again, we are in the middle of this evolving situation. We'll see how it goes. I am very comfortable for what I'm seeing. So let's see some of the great news that most Omicron patients are fully oxygenated with room air. Our media needs to get there. Absolutely. Barbara says, let's hope this protects against other coronaviruses once for all. So far, this is proven now. How it is proven is cases have changed from Delta to Omicron. So that is done. If Omicron is dangerous, then the cases have changed to Omicron. So now we have something dangerous at our hands. If Omicron is more uh, more transmissible and less lethal, then that again is this is what we have drawn. This is our next luck. So I think that is already done. But again, we would continue to wait for another couple of weeks. The long COVID is still a question. So V Intuitive says, looks like half were vaccinated, others has other problems. So vaccinated, and so please, I don't think that the takeaway is going to be that vaccinated are more um, at risk, or previously infected are more at risk. I think the takeaway is that the virus itself is becoming milder. Whoever it goes to, reinfects or breakthroughs or naive, uh, SARS-CoV-2 naive. And when I say SARS-CoV-2 naive, it is not an insult to anyone. SARS-CoV-2 naive means someone who did not have SARS-CoV-2 infection before. For example, hopefully, I was SARS-CoV-2 naive before vaccine, and then vaccination occurred and it made me aware of the virus, or somebody who gets an infection. So all three, I think, are showing to be milder. Kelly says, if this news is the same in 2 weeks, it will be a great relief. Absolutely. Absolutely. Scott from Florida says, our media will pick and choose anything that is close to bad and run with that headline. Agreed. So Philip says, how many were vaccinated? So let me just very quickly once again read it for you. So they're saying that the patient profile in the hospital, 80% are youngsters. And they're conjecturing that that is maybe because the older individuals are 57% vaccinated, while youngsters are less vaccinated. That is one. Secondly, in the wards, they're saying of 38 adults in the COVID ward on 2nd December, 6 were vaccinated, 24 were unvaccinated, and 8 had not known vaccination status. So 6 vaccinated, 24 unvaccinated in the wards. So what do you think? What is your takeaway? And the length of stay in hospital about 2.8 days compared to 8.5 days previously. Number of deaths are less. length of stay is less, oxygen need is less, people coming into the hospital are less, they are being found to be positive incidentally for other reasons that they are there. For pregnant women are getting it at a high rate as well. So obstetric reasons or other reasons or other diseases or diagnostic reasons, somebody went in for chest x-ray or something and they found. So this is very interesting. At least so far it looks like a fairy tale to me. This is a good question. Christian as Khobar says, can Omicron mutate back to a more lethal variant? Very good question. So good news, it cannot. Here is why. Again, it can go to an animal and then become bad from animal and come back to us just like other SARS-CoVs. But in humans, because it has gained more, if this data that we know so far is correct, and I'm using that data as facts, because it has become more transmissible, for it to become lethal will mean first it becomes less transmissible, then it can become more lethal. But to become less transmissible, it will have to have a competitor that is not more transmissible, right? It's going to have a match, a race with someone. So it's always going to, the daughters are always going to have a race with their parent now. And the parent is fast. So if the daughter is slower and more lethal, then the fast parent is going to overtake this. And this would not live on in more people because parent would jump first, or even if they both jump together, parent would take over. So it is going to become difficult for this virus now to go backwards, to say, hey, no, I'm not, for example, some I don't want to, I don't want to be more transmissible, I want to be more lethal. Then the current Omicron, if this all is the fact, then the Omicron parent would not let that happen anymore. Unless if some communities do not have Omicron, and then Delta would just keep going. Nancy says, I hope we are seeing the light. I hope so too. At least in almost 2 years of pandemic and sad news and discussing those, at least it gives us a glimmer of hope and a sliver of light that we can be happy for some time and discuss happy things. And I hope and I pray it stays that way. Mark says, the computer of the Great Reset is broken now. I can almost see so many people so sad right now who were uh, who were just causing so much anxiety by saying we're going to die, the AD is going to happen, and this is going to happen, and the selection pressure is going to happen, and we would just see this. So many, I think, big pharmas are going to say, "What the heck?" So I'm going to just show you for kicks um, my cartoon once again. Maybe we should make it a t-shirt. So Big Pharma is saying to the little O, Omicron, why are you doing this to me, bro? So what do you think? So this is what I think. This is what I'm seeing. This is what I'm thinking. What do you think? Absolutely. This is very, very important. We mustn't drop our guard because, yes, one, we do not fully know about Omicron. Number two, Omicron is still killing even vaccinated people. So that means somebody with the uh, comorbidities or someone at risk, even when vaccinated, could be at risk with Omicron. So it's not that it is just done, it is reduced in its lethality, it is reduced in the damage it is doing, but it is still doing damage. And we have no idea who is the one it becomes upset with. I always, even now, I feel that even if it is Omicron, I'm vaccinated, but I have no guarantees. So, Robin Hood, very, very important point. Thank you for bringing it up. Kelly says, are they still thinking of a longer incubation between exposure and symptoms appearing with Omicron? I haven't read that anywhere yet, but I am sure that that is how it is. And that is also useful. Mrs. Carother says, Dr. Bean Medical Lectures, please make your why you doing this to me, bro cartoon available on the t-shirts and coffee mugs for your cool beans. Okay, I'll put that up today and then I'll tweet it and I'll post it on community channel on YouTube, the link to the t-shirts. YouTube takes 2-3 weeks to approve it. For example, YouTube has already disapproved and asked the Teespring to remove my ivermectin merchandise. So it would appear on YouTube in a few weeks, but I can actually put that on the store and have the link tweeted and put that in Discord and put it on the YouTube community channel. Barbara says, YouTube can care me. Scott says, thank you for doing these lectures. There are so many of us who turn to your channel for honest data driven opinion that we can trust. Thank you very much. Bab says, loving the t-shirt idea and the big hopeful is stage making perfect sense. Yep. Lisa says, bottom line, being healthy is, yeah, absolutely. But this guy, this SARS-CoV-2 had not cared for anyone who was fit or not fit or healthy or not healthy. It was just ravaging through the system. And hopefully we have a so full circle says could O wipe out the other? That's what it is doing. So in South Africa, when we say it has become dominant and almost 100% is Omicron, that means it has wiped out the other one. How does it wipe it out? I did a discussion a few days ago. Sky Frog had asked that. The basic idea is, and it's a 4 or 5 minutes discussion. Now I can say I have 4 or 5 minutes discussions. What happens is, imagine from my throat, I shed Delta and Omicron together, and that lands in somebody else's mouth. Now, Delta and Omicron, both over there, are going to try to catch on to the virus, to the cells and replicate and increase in number and come out and catch quickly to the next cell and go in. This is like, there used to be, or there still is, Japanese ninja hurdles. What is that? The game in which there are hurdles and you have to run through them. So now Delta is running through the hurdle of catching the cell, grabbing the cell, getting in there, becoming more in number, coming out, grabbing the next cell, and just continuing. Omicron is doing the same. Guess who would win? Omicron every single time. So where would the Delta go? Would go crushed? That would be taken out by the immune system if they didn't kill the patient. If they kill the patient, then they both would die. Otherwise, Delta would die first. Omicron would continue and then shed again and go to the next person. And that is how Delta would be eradicated. That is how previous variants are eradicated, unless some communities are holding it because of less exposure to others, or some labs are keeping it for their research or for bad things to do in the future. So John Snyder says the people vaccinated who catch Omicron experience mild disease so far. Yes. This is a very important question, Christopher. We need to know what proportion will need to be hospitalized. That is a very important question. That, okay, so we now know how what happens to the people in the hospital, at least crude, as they say, crude information. What we still do not know is how many are actually becoming sick, and out of them, how many. Normally, what we knew from previous variants is about 20% of the people who get infection end up in a hospital. Here, what is that percentage is not known yet. We can say the population of 2-3 million, and this is the number in the hospital, and the numbers are dropping, cases are increasing. That in itself is a sign. For example, if I go here and I go to this is the deaths, but that means hospitalizations as well. So this is dropping and it is staying low. We thought that with this increase, the number of deaths would increase too, and we have now good enough time to second, third week. I believe we're in more than 3 weeks. They say 2 weeks. That's fine, but the number of deaths are reducing, and even the cases are now reducing. That means maybe people are actually getting it and thinking, well, this is just common cold. But this is a very important question, Christopher. You're correct. So now what says, can when can we rename this H cove 19? Yeah, so this will be called H cove 21, correct? This is 21. Oh, sorry. So COVID-19 to human COVID-19. Sorry, I forgot. Yes. So this would be called human COVID-19. I think, okay, so if we take whatever is there as something that would happen perpetually, and any variant that would come in would be even faster than this and even less lethal, then we are looking at a semi humanized variant. Okay, so Sumit says, Sir, does Omicron able to make sure schools close? It would get schools closed because it's going to get a lot of spread in the community. Lots of children are going to become sick. There may not be enough resources in the hospitals to take care of them, and schools might close. Although, bad news is that this report that I just read, they said that the hospitalization is on the lower side, the beds are empty. So, where did I read that? That was actually so good to read. So, one second. I'm going to bring in that here. Check this out. You would enjoy it, although not from school going folks. But here, Hotang's dedicated COVID-19 bed occupancy was still only around 13%. Maluliki said 13%. The cases are rising. Bed occupancy is only 13%. So Sumit, I don't know. Maybe not. I remember when we were in Massachusetts, my children would pray for the snow so that they can get off days. And I used to hate it because I had to clean my car to go to work. So Jan says, I'm in South Africa. My wife probably has the Omicron variant at the moment, very mild. This is the second time she has contracted COVID and has been vaccinated, Pfizer 2 times. So the psychopaths running big pharma are able to release new variants. So here's the deal. The more transmissibility will have to be an organic behavior in the virus. Now, for example, if somebody releases Wuhan virus in South African community of Gauteng, that Wuhan virus will be crushed in a second by Omicron. So someone will have to devise even faster virus. But if they devise a faster virus, that would have to be by definition less lethal. So this is out of many people's. If there is any conspiracy theory of somebody trying to use this to damage, that if we take these as facts, then that is gone. That is over. Lots of damage has occurred. Okay, so why not we stop here? If you like, I can come back and we can continue our chit chat. Otherwise, enjoy your weekend. So I'm gonna hang up and I would look at the comments here. If you want to continue these discussions, I can come back. Otherwise, we'll have a nice weekend. So please like, subscribe, and share. And please, if you would like to support this work, there is a link in the description to buy me a coffee or PayPal, or you can be a patron. And shout out to Margaret for a very generous donation once more. Thank you and bye bye for now. I'll read your comments in offline to see if I should come back.